Okay. Second, how about in Asia? Hindi nagbago. In fact, mas mataas ang Philippines than any other part in Asia. This is the Tony Dan study with some of the epidemiologists sponsored by the National Nutrition and Health Survey. Alright? The prevalence of hypertension in the country is a staggering 17%. So almost 20%. So if you have 80 million Filipinos right now, 20%, ilan ang hypertensive sa atin? Kaya hindi nagbabago ang mortality and morbidity through the years. Marami pa rin namamatay ng hypertension. And number 3 right now is cancer in terms of mortality. Now, the disease burden for 50% over 15 years or 17% prevalence rate of 15 years, you have about 7 million hypertensive patients right now diagnosed. So, mga 40 million, maybe the ballpark figure, but right now, we are sure that's close to about 7 million. Now, look at the level of education. I'd like to emphasize this. The prevalence, awareness, and treatment rates and control rates of hypertension according to the education status, elementary, high school, college. As you can see, awareness is very good, about 50%. But treatment and control in terms of addressing hypertension, may disparity between the awareness and treatment and control. So therefore, dinagamot ba? Or ina-address ba? So that's a question, ever since nagbabasa ako ng fellow about siguro more than a decade, hindi nagbabago. Sabi ko, bakit ganito? So I went back 1960, hindi nagbago. All over the world, it's like that. 50% awareness, control, ang baba. It's about 12 to 20%. And that is a question right now. Now, guidelines. Alam ko nakita dito so many times, but there's a different view right now. Gusto ko ipakita sa inyo. How many of your patients nakakaalam nito? Can you give me raise a hand? How many of your patients will know that hypertension is 140/90? 2 separate takings in 2 weeks. And how many of your patients would know na ganito ang gagawin natin? And how would they know? Diba? Well, Dok, sumakit ko ulo ko gabi. Nag-away kami asawa ko, high blood daw ako. So that is the layman's interpretation of hypertension. Tama ba? Hindi yung speed mo. Tama ba? Tama diba? So, that's the problem right now. Ang doktor ang masyadong magaling, pero yung pasyente ang iiwan in this country. When you have 1% health budget and 15% education budget. So, ito, hindi na natin kailangan i-discuss to. Kasi, simula tayo nag-aral ng medisina at simula namin nag-lecture for hypertension, I'm sure this is a tortured slide. This is a tortured slide. Again, compelling indications, I guess, for patients with diabetes and patients with chronic renal disease, wala na tayong pag-uusapan. ARB, ACE, calcium, alright? So this is just an enhancement of what you have learned. Heart failure. I mean, medicine has never changed. Heart failure, you treat that with ACE, diuretic, vegetalis, owido, diet. Nagbabago ba, Doktora? Hindi nagbabago. Post-MI, beta blockers, aspirin, Lavix, ACE. Tama ba? Araw-araw, day in, day out. Hindi ang ginagawa. High risk, same. And then angioplasty, perhaps bypass. Right? Tama ba yun? Right. Alright. How about the algorithm? How many of your patients na napakita niyo ito in the chart, in the ante-room, hindi siguro, algorithm ito. Diba? So, ang problem natin is that we are over-educated, but our patients are not. And given the short period of time na nakikita natin sila, I'm not sure whether we are able to impart or translate our knowledge to our patients. Tama ba? So, yun ang mga gulo-gulo sa isip ko as a physician right now. So what is the challenge right now? Hypertension continues to increase in prevalence, in morbidity and mortality. Not much has changed in terms of control of hypertension for the last 50 years. And we need more than an heroic measure. And we should help the government right now. Because at the end of the day, it's all about us. It's not all about the government. At the end of the day, tayo yun. Alright. Now, look at the rate of undertreatment. Again, what do you notice? These are some of the risk factors according to the National Health and Nutrition Survey. But there's one thing na napansin ko. This slide and this slide. I'm not sure whether you're sharp with that. Okay. If you see a patient with hypertension, you will always treat that. With diabetes, you will always treat that. Pero if you have a patient who is smoking, and perhaps this diet ka na lang, tumakbo ka na lang, 1 hour. Digit ka sa paninigarilyo, just like that. Tama ba? Pero hindi isipin, pwede ko lang siya bigyan ng gamot eh. So, ibig sabihin, the degree or severity of smoking is not equated with hypertension and diabetes. Ganon din ang attention na binibigay natin. But preventive health or the lifestyle modification is about 30 to 40% of the overall care of the patient. Now, paano gagawin yung patient? And some of your patients right now are actually still, even with MI, nag-smoke and hindi pa nag-diet. Because, ang sa atin, diabetes and hypertension are the two most important cardiovascular illnesses. I think, even in my private practice, yun din ang napapansin ko. So therefore, in a country in which the prevalence rate of hypertension, do you know that the prevalence rate of hypertension in this country is about 60%? 60%. 50% of the population, lalaki, and 50% are smokers. And that's why 5 out of the 10 causes of mortality are smoking related. And number 3 ang cancer ngayon. In Japan, number 1 ang cancer. In China, number 1 ang cancer. And it will be increasing because there's nothing much that we have done in terms of eradicating or preventing smoking. And together with hypertension is a multiplicity of all the risk factors. Sorry that we have to dwell on the risk factors. Kasi I think this is the most important thing before we actually treat